It became a Thursday night ritual. The nation, even the Prime Minister and his fiancée, clapping for the NHS. But that is a clap that has turned into what one health union has now described as a slap in the face. There was fury today as the government submitted a proposal for a 1% pay rise to NHS staff, including nurses. Touring Teesside today, the Prime Minister was asked about pay rises in general, though the figure had not been published at this point.
We're invested already in the health and social care sector, huge quantities throughout the pandemic, and I think the whole country is massively grateful to healthcare workers and social care workers for what they have done.
Words that did not wash with the unions. The Royal College of Nursing had asked for a 12.5% increase. This was, they said, pitiful and bitterly disappointing. The government proposal sent this afternoon to the independent pay review body affects Agenda for Change staff, that is all NHS workers except doctors, dentists and senior NHS management. The proposal is a 1% headline pay award. This comes off the back of a public sector pay freeze which includes teachers and the police.
This is an absolute kick in the teeth for our hard-working, brave NHS staff. Indeed, with the projections for inflation, it could be a pay cut for NHS staff, and Rishi Sunak was far too cowardly to announce it yesterday. He's trying to sneak it through today, and it's an absolute insult.
This is now in the hands of the pay review body, but even then, ministers do not have to agree with its recommendations. Well, I think after the year NHS staff have been through, which we've highlighted on Channel 4 News, there was an expectation that this would be recognised financially rather than through the applause on the steps. But if there was a hint that this might not be the case, it was the budget yesterday that must have lowered expectations, as the Chancellor made clear the country needs to start rebuilding its finances. And also in that budget, of course, there was no mention of future funding for health or social care, even with the expectation that the health service will have to deal with waiting lists, backlogs and COVID and testing and vaccinating and social care, of course. And we've been waiting for that oven-ready document promised by the Prime Minister when he came into office. Today's pay award proposal actually came as a shock to the unions. They weren't expecting it right now, and those I spoke to felt they had been blindsided by this. The Department of Health said in a statement that over 1 million NHS staff continue to benefit, though, from multi-year pay deals.
Well, now, the Chief Executive and General Secretary of the Royal College of Nursing, Professor Dame Donna Kinnear, joins us now from Hackney in East London. Dame Donna, could I just ask you what your immediate reaction was to hearing that this was the intended settlement from the government?
I was hugely disappointed and, in a word, angry, really, at the way our members and nurses and nursing staff throughout the country have been treated. I think the government have finally shown its hand.
And then I was sort of wondering, if you then look at the budget, which was yesterday, it was one in which they made no secret of the fact that we've kind of run out of money.
Yes. Well, actually, they may have made no secret of the fact that we've kind of run out of money, but they've made political choices about how to spend their money. And it is a political choice to continue to underfund and undervalue nursing staff.
One of the things which does strike one is that this is all sorts of workers in the National Health, isn't it? This includes some doctors, most nurses. Can you just tell us the sort of people who are most affected by this offer?
Well, it's anybody in the NHS that's on the Agenda for Change pay scale. And it isn't an offer, it's a recommendation to the pay review body. But for everybody that are coming off their shifts, already demoralised and tired, they'll be heartbroken and angry because this isn't the way to treat people in the middle of a pandemic when they have significantly underfunded the NHS. And we have had to work doubly hard to compensate for the lack of 50,000 staff across the UK. 50,000 nursing staff were short when we went into this pandemic. This will do nothing to attract people into the profession and retain them.
The government might argue that it's doing other things for the people affected by this pay rise.
It might do so, but the reality is that when we speak to our members and we speak to nursing staff up and down the country, the value that they want to see is pay in their pockets. And it's important that this government understands that. It's for the first time we're seeing how low down in the scale of things that the people that have worked continuously throughout this pandemic are being treated in this way.
Is there a danger that if you manage to get better than 1%, somebody else is going to suffer?
Well, as I said, it is a political choice where they choose to spend money, and they've chosen to spend money in several places. They've chosen to invest in court cases. Actually, they need to reward and pay the staff that have done the work continuously throughout this pandemic.
And finally, what would you say in answer to the Prime Minister, who we showed footage of praising the nurses earlier in the programme?
Well, I'd say it's not enough just to clap us. It's certainly important now to pay us for the overcommitment that we have demonstrated for over a year now.
Professor Dame Donna Kinnear, thank you very much indeed for joining us. Thank you.